Munchausen syndrome is a disorder characterized by the invention or fabrication of symptoms by a patient. The reasons why they do this are not often known to themselves, but the motivation of the fabrication is to acquire what we call the sick role. The term Munchausen syndrome has been replaced really by fabricated illness or factitious illness. If you look at patients who fabricate symptoms, the majority of them are actually female, the ratio of about 4:1. It can start at any age, but it's more commonly seen in adults. This is obviously something that's very serious, and we usually find that people who have these problems and do these things to themselves have emotional difficulties and psychological problems. Some of them have been victims of childhood abuse, and they grow up to have their needs met, if you like, by putting themselves through often dangerous and painful medical procedures. You may find that the patient's interfering with a wound, keeping it open. You may find that the patient is interfering or tampering with blood samples or urine samples or sputum samples, as maybe introducing blood into their urine is very common. Munchausen by proxy syndrome, the term was changed to factitious illness by proxy, and that involves the invention or fabrication of symptoms in a child by a carer, because this is a form of child abuse. The mother may fabricate a symptom in the child. So what then happens is that the doctor unknowingly will investigate that child. And here's where the problems occur, because the investigations can be invasive. They can involve doing very invasive and potentially dangerous investigations into the child, and that child may develop consequences, adverse consequences. The child may die because this has a mortality of about 10% associated with it. Detection and treatment of this disorder is vital. The diagnosis is usually suspected by a physician or surgeon, who will then call in a psychiatrist to see the patient and interview the patient, or to have a discussion about the patient, because they may have very firm, tangible evidence that the patient is fabricating symptoms. The policy that most people use is what we call supportive confrontation. Unfortunately, most patients will once they're confronted, walk out of the hospital. The treatment is complex, and usually it involves very long-term psychological treatment. If patients can understand the reasons for why they carried out these actions, then they can get well.